So just to place healthcare into context, the conversations at the Africa CEO conference have been around investment and growing the share of the pie for Africa, economic development in Africa, and healthcare is a big part of that. So in terms of economic development, healthcare is one of the world's biggest employers. So if you look at the NHS in the UK, for example, it's the sixth biggest employer in the entire world. If you look at the states, different states in America, healthcare is always one of the top three employers of every single state. So people look at healthcare in isolation as an industry that's almost like a cost, almost like a drain on the system, without seeing that actually healthcare has a massive multiplier effect when it comes to jobs, when it comes to economic prosperity, when it comes to security, because when people have jobs, then they're less likely to commit crimes. And when people are healthy, they're more likely to be productive. So actually, the NHS was not developed out of purely altruism. It's the biggest free healthcare system in the world, but it wasn't developed for purely altruistic purposes. It was actually not developed by a doctor. The person that came up with the idea, or the politician that came up with the idea, was an economist. And the reason, like me, I studied economics and finance after being a doctor, and I can see his reasoning. And the reason why he decided to sort of put the idea of the NHS forward is because he realized that people were getting sick, and the UK would not be able to compete with America in terms of manufacturing if everybody was so sick. So he brought about this idea of giving free healthcare to people so that they'd be productive enough to work. So in terms of healthcare and leapfrogging, the original question that you asked, healthcare is important because, number one, massive creator of jobs, which is important for Africa, particularly Nigeria, where almost 50% of the population are unemployed. Number two, security. When everybody talks about security, they don't make the link between security and the economics of the country. You will have a security problem in any country where there's 50% unemployment because people don't have things to do. But once you solve the jobs problem, then you inadvertently solve the security problem, or it's a big part of solving the security problem. So you help solve the economic problem attached to security. Then productivity is the third one. We work in Nigeria, we work in Africa, but our work isn't as productive as you see in Europe and the United States, right? So to get our productivity up, healthcare is also an important aspect of that, as well as innovation. So healthcare is like the glue that sort of great developed countries are sort of built on. And I don't think any country has achieved any sort of real advanced development without being built on the dual pillars of healthcare and education.
Interesting, but again, and I'm looking at what financing or funding model do we need in Africa? Is it a public-private sector partnership? Do we need to get the government out of the way? Do you need a government in healthcare funding? We've been trying all kind of things, but it doesn't seem to come together. Give me an idea. How can we get it done within the African context, considering the size of our informal economy, the kind of what is available? Are we going to tax companies for more health funding, interventions? What do we need? How do we fund it?
So I'll speak from the Nigerian perspective and bring it around to the Pan-African perspective. So if you look at the UK, for example, you'll see that 30 to 40% of GDP, the tax component is 30 to 40% of GDP. So that means that 30 to 40% of all the money made in countries like countries in Europe, like the UK, all the money, 30% to 40% of it, comes back to the government in tax. In countries in Africa, like Kenya, like Ghana, you see 15 to 13% of it, whereas in Nigeria it's just 6%. So imagine what the UK can do with 40% of their GDP. So 40% of all the money they make comes back to government in tax. Of course they can fund free healthcare. Whereas in Nigeria, only 6% of all the money we make comes back to the government in tax. So it becomes very difficult to fund healthcare. And then when you look at countries even like Afghanistan was busy fighting, the most powerful country in the world, and active insurgency. But still, their tax to GDP ratio was 9%. So 9% of all the money that Afghanistan made came back to the government in tax. So you can see that Nigeria is doing really, really poorly in terms of tax collection, and that definitely needs to improve to assist healthcare financing. I also think that the government has been trying to do everything themselves, and a rich government trying to do everything themselves is different from a poor government trying to do everything themselves. And if you have 6% of tax as GDP, if your GDP per capita, for instance, GDP per capita is your share, each person's share of the national cake. So there's a lot of people from Europe here. I met a guy from Luxembourg, I was just speaking to him earlier. His share of the national cake is actually $80,000, his GDP per capita. So if they divided all the money that Luxembourg makes by the number of people, he would get $80,000. If you did the same thing in America, you would get $60,000. If you did the same thing in the UK, you would get $40,000. Each person would get $40,000 in a year if they divided all the money that the country makes. In Nigeria, it's probably about $1,500. So it's a lot more difficult to fund large healthcare infrastructure projects because actually the amounts that we make are so small, and that's why public-private partnerships are so important. So my company specializes in doing public-private partnerships in healthcare because we believe that private sector capital can be catalytic when trying to fill this $66 billion healthcare infrastructure gap in Africa.
Interesting the way we can leapfrog this, but again, how do we mobilize folks at the bottom of the pyramid to be able to find affordable healthcare on the African continent? That is one very important conversation which folks we try the HMO, we try whatever, but 50% unemployment, where would you guys find the money? Because they don't even have the jobs to start with.
I don't even think that they should be paying for healthcare. So I think, giving Nigeria as an example, because that's the economy I know the most, we subsidize fuel, PMS. We subsidize electricity. We subsidize fertilizer. But we don't subsidize healthcare, and we don't subsidize to any large extent education. And if you look at the developed countries and the countries that are moving forward, they don't subsidize fertilizer to a great extent. Some of them do. There's some American subsidy schemes that do. They don't subsidize power to a great extent. They definitely don't subsidize PMS to a great extent. What they do is subsidize the two building blocks of any economy, that is evidence-based, empirical evidence support, that every country that wants to move forward should be subsidizing healthcare and education, and that's something that we've done very badly in. So definitely the bottom of the pyramid, very, very difficult. In America, in the UK, in Germany, they don't pay for healthcare. It's always heavily subsidized. And I think that if we want to build a subsidy regime that works for people and that lifts people out of poverty, then we should be looking at focusing more on healthcare and education and less on cheap fuel. Ghana doesn't subsidize. Ghana subsidizes healthcare, but doesn't subsidize fuel to the same extent as Nigeria. So as you find in Nigeria, people find it more profitable to actually take our fuel to Ghana and get the sort of, arbitrage on that. So if Ghanaians can afford fuel at the right price, then Nigerians can afford it as well. And we should be focusing on things that lift people out of poverty, like education, like healthcare. We have some of the highest maternal mortality rates in the entire world. More women die in Nigeria than almost anywhere in the world. It's one of the most dangerous places to become a mother in the entire world. These are the issues, not cheap fuel.
Do you think Africa CEOs need to watch their health?
I think Africa CEOs need to be advocating not only for their core industries. So we've spoken a lot about oil and gas, we've spoken a lot about agriculture, we've spoken a lot about general infrastructure aside from healthcare infrastructure, and these are all very important. But I think, beyond your core industry, Africa can happen to anyone. Africa has the worst healthcare in the world right now. More people die, more children die under the age of 5 years old from preventable diseases in Africa than anywhere else in the world. We have the highest rates of maternal mortality. We have the highest death rates from traumatic injury and accidents in the world. And I think that if we're still living in that circumstance, then we can't do meaningful business unless we have the basic building blocks of a civilized society, which I've repeated over and over again, which are healthcare and education. So our role as CEOs is not just to make profit from oil and sort of gas and palm oil and cash crops, but also make sure that the profits we make and the business we do is a force for good in our communities, and use our voices to advocate for better governance in the areas that really, really matter to the most vulnerable in our society.